How to deal with health anxiety and hypochondria. I'm going to talk about what health anxiety and hypochondria look like, and more importantly, what you can do about them. I'm Dr. Tracy Marks, a psychiatrist, and I publish weekly videos on mental health education and self-improvement. If you don't want to miss a video, click subscribe and the notification bell. This topic comes from a viewer question by Littleredridingkyle, who said, "You should do a video on hypochondria/health anxiety. I'm only 15, and mine is ruining my life. I can't sleep because I'm afraid my heart will stop due to some undiagnosed heart problem, even though I've had many tests and the doctor has repeatedly told me that my heart is fine." Thank you, Littleredridingkyle, for bringing up such an important question. With hypochondriasis, you misinterpret body symptoms and assume you have a serious disease, even after you've been medically cleared. You may believe the doctor missed something, or that your anxiety itself will eventually lead to a life-threatening condition like sudden death in your sleep or a heart attack. In 2013, the latest edition of the Diagnostic and Statistical Manual of Mental Disorders, DSM, renamed hypochondriasis to somatic symptom disorder. The term somatic refers to the body, so this condition involves being overly focused on bodily sensations and convinced that they indicate illness. People with this condition are usually very aware that something is wrong, because the anxiety they experience causes real distress. For this video, however, I'll use the older and more familiar term, hypochondria. With hypochondria, you're hyper-aware of every physical sensation. You constantly analyze your symptoms, trying to link them to a specific illness. The anxiety can become so intense that your body actually produces physical symptoms that match the illness you're worried about. For example, if you're worried about brain cancer, you may start to feel dizzy, lose your balance, or even develop headaches. Once your anxiety subsides, those brain cancer symptoms disappear, until another sensation catches your attention. So what's the difference between general anxiety, which also has physical symptoms, and hypochondria? Anxiety can absolutely feel physical. For instance, say you need to give a presentation. Your heart races, your palms sweat, and you may even feel lightheaded. If you don't have hypochondria, you recognize this as anxiety. You might even get a lump in your throat, but once a doctor reassures you it's anxiety, you're able to accept it and calm yourself. However, someone with hypochondria doesn't feel reassured. Even after visiting the doctor, they may think, "This is a new symptom, so it must be something different," or "The doctor missed something," or "There's some rare undetected condition that only shows up at the last minute, when it's too late." So what happens next? You begin researching. You try to figure out what's really wrong before it's too late. This creates a cycle of constant vigilance, fear, and self-monitoring. Why does one person feel reassured, while another doesn't? It's a conditioned response, something learned over time. Let me explain using a classic example, Pavlov's dog. Pavlov was a Russian scientist who studied learning and classical conditioning. He discovered that he could make a dog salivate by simply ringing a bell, if that bell had previously been paired with food. Over time, the dog associated the bell with food and began to salivate at the sound of the bell alone. In the same way, with health anxiety, you start to associate normal body sensations with serious illness. Your brain learns to fear those sensations and treats them as threats. Let's take a closer look. Suppose you've been anxious lately, maybe because you lost a job or have a looming deadline. Then you feel something physical, like acid reflux. Because you're in an anxious state, and you're imagining worst-case scenarios, your brain learns to associate burning in the chest with a heart problem. So what do? You Google it. Again. And you read a story on Reddit about someone who experienced chest burning before bed, and then died in their sleep. Now you've collected proof that your symptom is more than anxiety. So you begin to test your theory by paying close attention to every sensation around your chest. You start another round of research about heart failure. You learn more symptoms, and then, sure enough, you start to feel those symptoms: shortness of breath, tightness, or swelling in the legs. Eventually, you return to the doctor. This time, you have new symptoms. The doctor checks you again and says your heart is still fine. Maybe they even suggest it's anxiety. You might feel slightly better while at the clinic, but once you leave, you think, she didn't even do a full body scan. How could she know nothing's wrong? Now you're more anxious than before. You start to distrust doctors. It's just you and the internet now. You survive the night again. Your symptoms improve a little. You tell yourself you're okay, for now. But you'll keep monitoring. Because you're not really safe. Not yet. And then comes the third layer of this cycle, constant checking. You become hypervigilant. You scan your body for signs of illness. You notice every twitch, every heartbeat, every breath. And if one symptom fades, another one takes its place. That's the exhausting life of someone with hypochondria. It's deeply distressing for the person suffering, and frustrating for those around them who are trying to help. So what can you do about it? Medication can help manage anxiety, but it doesn't address the core of the problem, the thought and behavior cycle. Typically, serotonin-enhancing antidepressants like Prozac are used. They help reduce anxiety but don't stop the obsessive thoughts. A more effective approach is cognitive behavioral therapy, CBT. CBT helps you reframe the distorted, automatic thoughts that link normal sensations to catastrophic illness. For example, many people with hypochondria believe that being healthy means feeling nothing. If they feel dizzy after standing up, they assume it's a serious disease. CBT also addresses behaviors, like excessive research, symptom checking, and frequent doctor visits for reassurance. What does CBT involve? First, get a medical checkup, just to rule out real conditions. Just because you have health anxiety doesn't mean you can't also have real issues. The problem is assuming that every issue is life-threatening. Once cleared medically, you can focus on treating the anxiety itself. Second, find a therapist who is trained in CBT. You don't want to spend sessions just talking about your childhood or your relationship with your parents. That kind of therapy can help some problems, but with hypochondria, you need structured strategies that target your anxious thoughts and behaviors directly.